Hi, my name is Sam, and today I will be demonstrating how to take a patient's vital signs. The first thing that you want to do when you walk into a patient's room is to sanitize your hands. By doing this, you are decreasing the transmission of disease. The next thing that you want to do is introduce yourself to the patient. Hi, my name is Sam, and I'm going to be your nurse today, and we'll be taking your vital signs. Can you please state your name and date of birth? By asking the patient for two patient identifiers, you're ensuring that you have the right patient. The first thing that you want to do when taking the patient's vital signs is taking their temperature. You want this to be around 37 degrees Celsius or 98.6 degrees Fahrenheit. The next thing that you want to do is take the patient's pulse. You're going to do this by feeling the radial artery. Once you can feel it, you're going to count the number of beats that you feel for 30 seconds. After you do that, you're going to multiply that number by 2 to get a full beats per minute. You want this number to be between 60 and 100 beats per minute. The next thing that you're going to do is watch for the patient's respirations, and you can do this by watching their chest or belly expand. You want this to be in the range of about 12 to 20 breaths per minute. If it's more than that, the patient may be in distress, and if it's less than that, the patient may have difficulty breathing. The next thing that you're going to do is listen to the patient's lung sounds. You're going to place the stethoscope on their back and ask if they can take in a deep breath while you do this. You should also tell the patient that if they are to feel faint or dizzy at any time that they should let you know, and you will stop the procedure. You want to listen to see if there are any adventitious sounds, which can be things like fluid in the lungs or an obstruction. After you listen to the lung sounds, you want to move on to the blood pressure. You're going to put the cuff around the patient's arm and make sure that the arrow is facing the medial artery. You are then going to put your stethoscope on the medial artery, and then you're going to inflate the balloon. You're going to inflate the balloon to about 160 to 180. Once you get there, you can slowly decrease the air, and you're going to listen for the first heart sound that you hear. That's going to be your top number. Then once you stop hearing heart sounds, that's going to be your bottom number. You want this to be in the range of about 160 over 80. If the patient has a higher blood pressure than that, that can indicate hypertension. Throughout the whole procedure, you want to make sure that you're keeping the patient informed with what you're doing so that they do not feel threatened or frightened. Thank you for watching, and I hope this was an informational video.